Hey Elaf, this is Yashasvi from Health 2.0 conference. Very
Yeah,
congratulations for getting recognized on our platform.
thank you very much. It was such an honor.
All right. Can you please introduce yourself and the organization you're representing today?
Yes, so I understand that it's the norm for people to start by introducing themselves in terms of their career and credentials.
Right.
Um, but I do believe that we're all far more than that. And personally, I would represent myself as just another ordinary person who wakes up every day to pursue their passion for positive change.
Right.
Um, as for my qualifications, I am a physician surgeon. I have been working in head and neck surgical oncology for almost 10 years.
Okay.
I have two master's degrees, one in oncology and one in maxillofacial prosthetic rehabilitation.
I see.
On a separate scale, I'm a certified neurolinguistic programmer and cognitive behavioral therapist. I have multiple postgraduate diplomas in hospital management and a Lean Six Sigma Master Black Belt in healthcare.
Okay.
And I'm a certified professional in healthcare quality. I have also founded my own company in 2018. It's called SENEB-Gen. So basically, it's a dynamic and expanding healthcare services and education company that strives to support comprehensive medical approaches,
Okay.
technology integration, and data-driven solutions in order to streamline operations and enhance patient outcomes.
Okay.
We support both healthcare providers and patients to do better and be better.
I see. That's really good to know that, and I'm really happy to hear about your qualifications. That is really good to know that. So, like, if we talk about this industry, the healthcare industry, like, how do you think this industry is transforming lives at a global scale?
Okay, so to be completely honest, I think that for the past couple of decades, there has been so much wrong with the healthcare industry to the point where it has literally suffocated both healthcare providers and patients in some parts of the world.
Right.
The titer of disease has gotten higher, the curve sharper, and the level of burnout has increased exponentially amongst healthcare professionals and students.
Right.
Um, and I think that the belief of the public in the powers of medicine has been slowly coming to a fall. The good thing about this is that it has increased to the point where it has become noticeable by everyone
Right.
and is finally being addressed. So,
Right.
for so long, we have been treating our healthcare providers like robots with superpowers and our patients as just elements of disease.
Right.
Fortunately, now we understand that the only approach that can save both sides of the equation is the holistic approach.
Right.
So it is extremely rewarding for healthcare providers to do more for their patients, to do more than just prescribe a medication. And patients also need to be seen as full blown individuals with an entire story and reality beyond just a diagnosis.
Right.
Um, one of my dear colleagues once said that what we do is sick care, not healthcare. And I think it's very true. So, a good healthcare provider would look beyond the complaint and use their knowledge and expertise to support the patient in terms of overall nutrition, physical health, mental well being, and so on.
I see.
So the fact that more and more physicians are starting to implement the holistic culture and the holistic approach is absolutely fascinating
Right.
and true spark and really hope for legit transformation.
I see. That's really good to know that. Other than that, like, how did it feels to receive the recognition for your own accomplishments?
I'm, of course, extremely honored to have received this recognition. I think most of all, I was surprised when your colleagues reached out to me about the award.
Right.
I guess we all wake up every day and we strive to accomplish our goals and we fight for what we believe in. And there are really more challenging days than there are good ones. And sometimes you think that your effort has gone to waste or was not noticed, but
Right.
then you receive a letter or a text or a phone call or a recognition like this one, and it really makes you feel seen and appreciated. And I think it pushes a person forwards to continue influencing positive change. So again, thank you again for the recognition.
You're welcome. That's really good to hear that. Other than that, like, what do you think about a conference? I'm sure you must have watched it virtually,
Yes, so I have unfortunately not attended the conference in person, but I
right?
did attend it virtually. And I think what I loved the most about it was the diversity of the topics and the speakers.
Right.
The fact that time was taken to talk about not just physical well-being in pharmaceutical terms, but also overall well-being in terms of spiritual health and mental health and recovery and improvement. It was all very, very interesting. And the fact that the speakers came from very diverse backgrounds, I
Right.
think served that purpose very well.
I see. That's really good to know that. Please, Elaf, tell us where we can find more about you or where we can find more about your organization.
Yes, of course. So we have a lot of surprises coming up soon.
Okay.
Our official website will be going live by the end of the year, and I'll be sharing all the updates on my social media pages.
Okay.
You can find me as Elaf Ibrahim, that is ELAFIBRAHIM, on virtually all social media platforms. So stay tuned.
All right. That's really good to know that. Thank you so much, Elaf, for having me. It was lovely speaking with you. And yes, I'll
Thank
be more
you.
than happy to see you in our upcoming healthcare conference as well.
Hopefully, yes. Thank you very much. It's been great to see you.
Likewise, likewise. Have a lovely day. Bye bye.
Bye bye.